Hi, I'm Rose, and I'm gonna be your student nurse today. How are you?
Good, how are you?
Good. I'm gonna perform hand hygiene. If it were necessary, I'd wear gloves and PPE. I pulled a curtain, but today we don't have a curtain, so the door is shut. Can you give me your name and date of birth, please?
Ella Cruiser 10403.
And can I see your wristband? Okay. Any allergies I should be aware of?
No.
Okay, I'm gonna go ahead and check the provider's order. He's ordered a musculoskeletal and integumentary assessment. So I'm gonna be looking at your skin and feeling your muscles and joints today. Is that gonna be okay?
Yep.
Okay. Before I begin, I'm gonna verbalize my scale. So A, B, C, D, E. A is asymmetrical, B is border, C is color, D is diameter, and E is evolving. And then my muscle scale, 5 is normal, 4 is slightly weak, 3 is weak, 2 is poor range of motion, 1 is severe weakness, and 0 is paralysis. Are you comfortable today?
Yep.
Okay. And I don't have any equipment I need today besides this watch, and it is sterile, or clean, not sterile. Do you see a dermatologist regularly?
No.
Do you have any new open wounds?
No.
New rashes anywhere?
No.
Okay. I'm gonna look at her mucous membrane, so I'll look in your mouth, and I'll have you push your cheeks out, and then stick your tongue out. Okay, and I'll have you pull down your conjunctiva. Looks good there. I'm gonna go ahead and look at your fingernails. I'm looking for size, shape, and contour. And at her toenails, I don't see any clubbing. Now I'm gonna go ahead and look over her skin for any erythema, pallor, or cyanosis, which I'm not seeing. And now I'm gonna look for lesions, bruises, or rashes, which I'm not seeing. Her chest, arms, and feet look good. And I'm gonna go ahead and palpate for temperature, which feels warm and even. And then I'm gonna feel for texture, which feels smooth and moisturized. I'm gonna go ahead and check her skin turgor. It looks like she's hydrated. I'll have you work on putting your shoes on while I ask a few questions, or your socks. Have you ever broken a bone?
No.
Have you ever torn anything?
No.
And are you active daily?
No.
So the first thing I'm gonna do is look at her anterior posture. I'm making sure she's standing up straight, which looks good. I'll have you turn around. Checking for kyphosis, which is a hunchback, lordosis, which is a curve inward, and scoliosis, which is an S-word curve, which I'm not feeling or seeing any. Now we're gonna do a few tests. So I'll have you walk to me, heel to toe, and then backwards heel to toe, and I'm checking for balance on this. And now I'm gonna have you rub your shin down here. Perfect. And then we'll have you close your eyes one finger at a time to your nose. Looks good. Now we're going to do the Romberg's test. So I'm going to have her stand for 30 seconds with her eyes open, and when I say close them, you'll close them. And go. I'm making sure she's not going to fall over when she closes her eyes. Okay, and switch. Now she has her eyes closed, and making sure there's no changes from when she had her eyes open. Alright, do you feel okay?
Yep.
She passed the test. So now we're going to go ahead and check her sternomastoid muscle. I'll have you turn your head side to side. And then put pressure against my hand. And now her trapezius, I'll have you show your shoulders. And then same thing. So I'm inspecting first, and I'm palpating for all of these. So your deltoid, I'll have you go like this. Okay. And then her biceps are like this, and her triceps are down. So we'll start with biceps, and then triceps, and now we're going to check her hand grip. And then I'll have you squeeze my hands. And everything felt even and symmetrical there. So now I'll have you step forward so we can get your hips. So it'll be abduction, adduction, abduction, adduction. And I'll have you keep your leg out there. Abduction, adduction, abduction, adduction. And then we'll have you sit on the bed. So I'm going to have you move your legs up. Those are your quads. And then down is your hamstrings. So I'm testing her quads, so we're going to go up on the ankles, and then her hammies are down. And everything's good there, so now we're going to start looking at our joints. So I'll have you come back up here again. So the first joint we're going to look at is the temporal mandible. So I'll have you do, I'll be open and close your mouth. And that is going to be flexion. I'll have you open your mouth and extension, close your mouth. And then I'll have you do that again. Okay. And now we're going to do her shoulders. So I'll just have you do it with me. Her cervical spine. So flexion is forward, extension, rotation, rotation, and then lateral flexion, lateral flexion. Now I'm going to feel that. And I'm inspecting these and palpating these once again. Lateral. There we go. And now we're going to do your shoulders. So flexion, extension, abduction, adduction, internal rotation, external rotation. I'm going to just feel them at the same time here. Okay. And now we're going to move on to your elbow. So flexion, extension, pronation, supination. Pronation, supination. And then we're going to move on to your wrist. So flexion, extension, rotation. And I'm going to feel those. Flexion, extension, rotation. And then we're going to test her hands. So I'll just have you go like this. And I'll do. And then now we're going to do your fingers. So abduction, adduction. And she already straightened them out. So I'll have you do that for me again. Okay, perfect. And then before I forget, all of her muscles were normal size and shape. And all of them on the muscle scale were a 5. They all felt normal. I didn't feel anything abnormal. So now we're going to move on to your hip. So we have abduction, adduction, and then flexion, extension, and then rotation. And I'll feel this hip first, and then we'll do it on the next hip. So flexion, extension, abduction, adduction, rotation. And I'll inspect it on the next hip. Flexion, extension, abduction, adduction, rotation. And I'll have you do it again. Okay, I'm not feeling anything abnormal there. So now we'll have you do your knees. So flexion, extension. And then on the other one as well, flexion, extension. And then I'll feel that. Feels good. And then on this one, I'll go ahead and feel it. Feels good. And now I'll have you sit down. And we're going to do the ankles here. So dorsiflexion, plantar flexion, inversion, eversion, and then rotation. And I'll go ahead and feel them. Dorsiflexion, plantar flexion, inversion, eversion, and rotate them around, which feel good. And I'll have you stand back up so we can do your spine. So it's going to be flexion, extension, rotation, and then lateral. Have you bend. So now I'm going to go ahead and feel that. I'll have you do it again. Flexion, extension, rotate. That works. Lateral, lateral, and rotation. Oh, like twist yourself side to side. Okay. All right, that should be it for today. Do you have any questions?
No.
Okay. Do you have anything I can do for you before I leave? I have time?
No.
Okay, perfect. I'm going to sanitize my hands. And the 5 moments are hand hygiene before you touch a patient, after you touch a patient, before a procedure, after you touch a patient's belongings, when your hands are visibly soiled. Make sure the bed is low and locked, the table is within reach. She has her call light, the room is clear of obstructions, the side rail is locked in place. I don't have any equipment to sanitize. But if I would, I'd make sure I gather and clean and take it all out of the room. And I'm going to document anything abnormal according to agency policy and document the rest in OneNote.